My fellow Idahoans, we are in the middle of an unprecedented and dangerous time in our state's history. With every day that passes, we are breaking records for the number of COVID deaths, the number of overall hospitalizations, and the number of new cases in communities all across our state. 749 of our fellow Idahoans have died from this aggressive disease, leaving a hole in the hearts of those who love them. Thousands of our fellow Idahoans of all ages have been hospitalized, suffered immensely because of COVID. In fact, about 40% of hospitalizations have been among those in their 40s and 50s and younger. Our coronavirus response has been about protecting our at-risk loved ones from this highly contagious and damaging respiratory disease. Our pandemic response also has been about preserving and elevating healthcare capacity so that we can all have access to care whether we have COVID or not, as demonstrated in my chart. Our hospitals and other healthcare providers are telling us too many healthcare workers across Idaho are out sick with COVID and they are contracting it within the community. And doctors and nurses who are healthy are overworked and burned out. This is the biggest challenge facing healthcare right now, the availability of trained, healthy nurses and doctors to care for all patients, not just COVID patients. And our hospitals are telling us that traveling nurses are increasingly hard to find. Idaho's largest healthcare provider just announced they won't schedule certain elective surgeries and procedures until Christmas. Our healthcare facilities are facing the same situation. They will discontinue all but the most essential services within the next few weeks. This impacts all of us, whether we have COVID or not. Our healthcare facilities are always rebalancing and shifting resources as needed, but the stress on our healthcare system as a result of COVID spread in our communities is simply not sustainable. Alarmingly, our hospitals are telling us it is only a matter of weeks at the current rate of spread before they must start rationing care. This means they will have to turn away people from the ER, or they will be unable to provide the best care for patients with COVID, heart attacks, strokes, and other health issues. This is unacceptable, and more must be done. Today, I am signing an executive order mobilizing the Idaho National Guard to respond to this emergency and expand capacity within Idaho's medical and long-term care facilities. The National Guard is always ready to assist with the emergencies and natural disasters. They are heroes and an incredible resource in times of need. My executive order calls up 100 guardsmen to increase critical access in healthcare statewide. Adjutant General Mike Garshak is here and will expand on how guardsmen will assist. Folks, all along our pandemic response has been driven by science. The science tells us that transmission is happening in small group settings with our friends and loved ones, where we tend to let our guard down about physical distancing and masks. Taking the right action in public is incredibly important, but it's more important that we continue those practices in all areas of our lives. That means we all must limit social gatherings and practice physical distancing and wearing masks with anyone, anywhere who is not a member of our household. The science also tells us that transmission is not happening primarily in classrooms, which continue to be safe places to work and learn, but during the ancillary gatherings around schools. Today, I'm also signing a statewide public health order rolling Idaho back to stage 2 of our Idaho Rebounds Plan with some modifications. What does that mean? It means gatherings of more than 10 people, indoor or outdoor, are prohibited. This does not pertain to religious or political expression. It means at-risk Idahoans should self-isolate. It means all Idahoans are encouraged to telework whenever possible and feasible. It means masks continue to be required at long-term care facilities. It means bars, nightclubs, and restaurants continue to operate, but patrons must be seated other than to enter and exit. This does not mean Idaho's economy is on lockdown. Businesses and churches will remain open under the new statewide public health order. However, all individuals and businesses should continue following recommended protocols to minimize transmission, including wearing masks when around others not in your household. Those protocols are available at rebound.idaho.gov. I want to reiterate something I have said many times before. It is very important that our students remain in their classrooms for in-person instruction as much as possible. We put millions of dollars towards the safe reopening of schools. Schools are controlled environments, and they remain safe places to work and learn when protocols are followed. School buildings are not the place where most virus transmission is occurring. The school closures threaten the biggest capacity issue facing our healthcare system, the availability of healthy workers. If a healthy nurse or doctor has to stay home to facilitate online learning for their children, then they can't care for the sick and get us through this crisis. Our kids need to remain in school for in-person instruction as much as possible. I also want to talk about masks. COVID-19 is a highly contagious respiratory disease that spreads by spraying droplets from your mouth onto others by talking, sneezing, or coughing. Masks not only prevent you from spraying droplets on others, but it prevents you from breathing in the droplets from others and catching the disease. It's that simple. It is a fact that has been supported by countless scientific studies. Half of Idaho's population is under a current local ordinance requiring masks, but we are seeing non-compliance with these local orders. Or people are wearing their masks in public, but then taking them off in social settings, such as parties and other gatherings with friends, where the virus is more likely to spread. Law enforcement has the ability to cite individuals for violating local ordinances, but law enforcement cannot be everywhere all the time. That is why I maintain that this comes down to personal responsibility. Please wear a mask when you're around another person who's not in your household. It will protect you and your loved ones. It will slow the COVID spread. It will keep people employed and protect our economy, and it will preserve healthcare access for all of us. What does this mean for Thanksgiving? It is best to celebrate with others in your household and avoid traveling, so you don't unknowingly spread virus to loved ones. You can still connect with one another, but please do so safely. There are a lot of good tips from public health on how to celebrate Thanksgiving safely. I know these are difficult times and difficult choices. I continue to have great confidence in the people of Idaho to do the right thing, to protect themselves and their loved ones during this challenging time of our history.